Welcome to your MAP update training for October 2018 on the 2019 Medicare updates. Updates to the Part A and Part B premiums will be announced in mid-October. Stay tuned for more info on that. When a beneficiary receives care at the hospital but is under observation status, Medicare Part B will pay. If the beneficiary is receiving care and admitted at the hospital, Part A will pay. The issue is the Part B copayment. For many beneficiaries who need skilled nursing facility care after being at the hospital, they don't realize that Medicare will only pay after a 3-day hospital admission under Part A. Make sure that you have the beneficiary verify admission status with the admitting physician and the hospital and received a MOON status form before choosing to go into a skilled nursing facility. There are no changes to the Medicare home health care. In Michigan, a pre-claim review is necessary for the home health care. The beneficiary must be homebound and the home health care must be medically necessary. This is conducted at the provider level. Nothing will be required of you. This is occurring because Michigan has been identified as an area with a high instance of improper home health care payments. Home health care companies sometimes provide home health care to people who are not homebound. The new Medicare cards have been mailed out for the state of Michigan, and you will start to see some of those occurring during open enrollment. They will be a combination of letters and numbers, 11 characters in length. There will be no gender line anymore. And people will have up until the end of December 2019 to use their old card before requiring that the new card is used throughout Plan Finder and any health services at physician offices. Also, as a reminder, please inform beneficiaries that they do not need to confirm their Social Security number with the Social Security Administration before getting that new card. The Healthcare Marketplace and Medicare. The Marketplace and Medicare are not designed to work together. When someone becomes eligible for Medicare, they can and should drop their Marketplace plan in favor of Medicare. If they do not enroll in Medicare, they will lose their tax credits for their Marketplace plan, and they will be penalized for not enrolling in Medicare when they've aged in. Now let's take a look at our fall timeline. In late September, the annual notice of changes were mailed out, as well as the Medicare and You 2019 books. For October, the 1st of October, marketing began, and October 15th, open enrollment begins. In November, we will get that Part B premium and COLA information, if not beforehand, in late October. And December 7th is when open enrollment ends. January 1, any of the plans that beneficiaries enrolled in during open enrollment will begin. Here's a quick look at our fall mailings. We have our Social Security Administration sending out the LAS redetermination or loss of deemed status letter in September. CMS sending out the reassignment consistent poor plan notice, LAS chooser, Medicare and You 2019 between late September and October. And plans began sending out marketing materials, annual notice of changes, and plan non-renewals in late September to October. There is no continuous open enrollment for Medicare's Part D drug benefits. Most beneficiaries have limited time frames to enroll in, disenroll from, or switch Part D plans. There are 3 enrollment period categories. You have the initial enrollment period, which is the first 7-month period when first eligible for Medicare. The annual open enrollment period from October 15th through December 7th, and special enrollment periods, which would be considered when a beneficiary has moved, has received LAS, or has had a loss of coverage. In an effort to promote better plan quality and better choice, Medicare will be sending notices to those who are in a Part D drug plan or Medicare Advantage health plan that fails to get at least a 3-star quality rating for 3 straight years. The notice lets them know about a special enrollment period to enroll in a 4 or 5-star plan. In a similar effort to promote informed and better choice of high-performing plans, Medicare is disabling the online enrollment feature in the Medicare Plan Finder tool for plans that are low performing, 3 or fewer stars for 3 consecutive years. These plans will have a low performing icon along with a message warning consumers of the plan's poorly rated performance. Please see the sample below on the slide. Your clients still interested in enrolling will get another message letting them know they will need to call the plan directly to do so. In 2019, there will be a new Medicare Advantage open enrollment period. What does that mean for 2018's open enrollment period? October 15th through December 7th will be business as usual. There is still opportunity to switch any MA plans as needed during open enrollment for 2018. From January 1st through March 31st of 2019 going forward, beneficiaries can now switch from one MA plan to another, meaning they can go from MA to MA, MA to an MA with Part D, MA with Part D to MA with Part D, and MA with Part D to MA. They can also leave a Medicare Advantage plan to join Original Medicare, coordinating their Part D with a special enrollment period. They also can add or drop Part D when switching plans, providing that the Part D will work with that MA plan. Please note that Part D is not guaranteed unless the beneficiary is enrolled in an MA plan on January 1st. What beneficiaries cannot do during the MA open enrollment period of 2019 forward, they cannot switch from one standalone Part D plan to another standalone Part D plan, much like you would during open enrollment. They also cannot join a Medicare Advantage plan if in Original Medicare. I also would like to note that Medicare Advantage plans will begin offering some supplemental benefits starting in 2019, like over-the-counter benefits, home-based palliative care, and more. Ask your site coordinator for the list of the supplemental benefits. For beneficiaries who are dual enrollees, Medicare and Medicaid eligible, or those who have LIS, will now have a special enrollment period limitation. Starting January 1st of 2019, beneficiaries can only change plans one time per calendar quarter during the first 3 quarters of the year. Annual open enrollment period can be used in the 4th quarter. These individuals will have another 3-month special enrollment period following any gain, loss, or change to Medicaid or LIS status. Notification of a CMS or state-initiated enrollment action. Duals or LIS eligible individuals who are determined at risk for misuse of frequently abused drugs will not be able to use the dual LIS special enrollment period of one time per calendar quarter to change plans. The Comprehensive Addiction and Recovery Act, also known as CARA, established a drug management program. These individuals will be notified of their at-risk status under the drug management program. The limitation lasts until the at-risk determination expires or is terminated by the plan. Decision is based on opioid use, dosage, number of providers, number of pharmacies that the beneficiary has been to, and this decision can be appealed. Medicare Plan Finder reminders. You can do a personalized search for a beneficiary. You can do so using their drug list ID to pull up their current drugs. It'll show LAS eligibility, and it'll also show the current plan that is auto-loaded for that beneficiary. Please, please, please write down the drug list ID and password for the beneficiary. This information is extremely important when logging your client contacts on ShipTools. The plans will automatically default to 2019 plan data. However, you can change it to 2018 data by selecting the 2018 hyperlink. As always, remember to poke the bird using the agency ID below. Here's an example of where to poke the bird on your enrollment form. The bird icon is darker this year and almost completely black in that top right corner of the personal information box. Once you've clicked the bird or poked the bird, the partner information box below will pop up where you can choose State, Michigan, and enter in 800-803-7174 into the agent ID box. Do not put any hyphens in with the numbers. Open enrollment FAQs. If I enrolled the person in a Part D plan or an MA Part D plan and the person has changed their mind, can anything be done? Absolutely. You can enroll him or her in another plan. The last enrollment will be the enrollment that takes effect. It is a recommendation that you do so the following day after that initial enrollment so that the system does not get confused. Can I enroll a person in an MA only plan with no drugs and a standalone Part D plan? For HMOs or PPOs, no. If someone enrolls in an MA, HMO, or PPO, he must get the drug coverage through the MAPD plan. For those who get a private fee-for-service or a PFFS plan, yes, someone can certainly enroll in a PFFS plan without drug coverage, if available, and enroll in a standalone Part D plan. There is, however, only one private fee-for-service plan in Michigan. Check your MA landscapes and with your site coordinator to confirm if there's one in your county. As a reminder, if a person is enrolled in an MA plan and switches or disenrolls, but has had a dental, vision, or hearing rider with the previous plan, that rider is still in effect. The beneficiary must call to cancel that rider separately. Medicare Plan Finder Problem Triage. First and foremost, we want to rule out any issues with the computer that's being used or the network. The Medicare Plan Finder bandwidth also can be a problem when everybody's on at the same time. Peak times are 11 a.m. to 5 p.m. Before filling out a Medicare Plan Finder intake form, we need to make sure that the Medicare Plan Finder problem can be replicated. If it can be replicated, make sure to connect with your site coordinator to fill out the MPF intake form and send that off to Robin Ukaz at Map Central. Now let's take a look at the 2019 Part D Standard Benefit Structure. Here's a look at our 2019 Standard Drug Benefit. Standard drug benefit parameters for 2019 show the deductible around $415 with an initial coverage limit of $3,820, an out-of-pocket threshold at $5,100, and the minimum cost sharing in the catastrophic coverage between $3.40 to $8.50. The coverage gap discount the beneficiary pays for a name brand drug is 25%, and for a generic is 37%. The Part D penalty is based off the national base premium, which is $33.19. Any extra help copayments for those who are institutionalized or My Choice home and community-based service, they have a $0 copayment. For those at the 100% federal poverty level and Medicaid, they're at $1.25 to $3.80 for a copayment. Full extra help is a $3.40 to $8.50 copayment. Partial extra help, the deductible is at $85 and the copay is about 15%. The LIS benchmark premium is at $32.91. Here's a look at the 2019 Standard Medicare Part D Basic Benefit Structure image. Medicare prescription drug plans may offer more than the standard coverage, including tiered copayments or coinsurance, lower deductibles. They may eliminate the gap in coverage, where a beneficiary pays 100% of their prescription costs, and they could change the coverage limit. An example, different dollar amount where a beneficiary begins to pay 100%. In 2019, beneficiaries who reach the donut hole will pay 37% for their generic medications and 25% for their brand name medications. The donut hole will continue to reduce each year until it is completely gone. Please note that LIS beneficiaries do not have the gap in coverage, so they will not see a change in the benefit structure. These beneficiaries will continue to pay their LIS copay throughout the year until or unless they reach the catastrophic level. Here's a look at the structure for closing the coverage gap. Starting in 2015, beneficiaries were responsible for 45% of their brand name drug coverage and 65% for their generic. Now in 2019, beneficiaries will pay 25% for their brand name drugs and 37% for their generics. Looking forward to the future, 2020 is showing a 25% payment for their brand and generic drugs in the coverage gap. Late enrollment penalty. If a beneficiary does not have credible coverage and they do not roll in Part D, then they must pay a late enrollment penalty. Penalty is added onto the monthly premium, and this will continue as long as they are enrolled in Part D. The Part D late enrollment penalty is calculated as 1% of the Part D base beneficiary premium, which is $33.19 in 2019. This 1% goes for each month a beneficiary does not have credible coverage and is not enrolled in Part D. The penalty amount does change each year as the Part D base premium does change also. So what if someone never enrolled in Part D and needed to do so now? We would start counting from June 2006 through December of 2018. That would be 7 months they went without Part D in 2006, and another 11 years from January of 2007 through December of 2018. That's a total of 139 months. We take 139 and multiply that by 1%, giving us 139% times that premium of $33.19, giving you the 2019 monthly penalty at $46.13. Part D premiums will be subject to income adjustments similar to Part B premiums. Beneficiaries with significant income will pay on a sliding scale higher Part D premiums. There are now 6 income categories. Each category has a set dollar amount associated with it. The table reads for 2019 Part D IRMA as the beginning level of less than $85,000 for an individual tax filer, or anything less than $170,000 for a joint tax filer income, leading a $0 addition to the Part D premiums. The Part D premiums will begin to increase based off of the income level for each beneficiary, depending on whether they filed individually or as joint. And we can see anywhere from a $12.40 tack on to $77.40 additional charge to the premium. 2019 LIS and Extra Help. Those income thresholds are based off of the federal poverty level. These numbers will be announced in January, but if eligible now for LIS or Extra Help, they should be eligible remainder of 2019. Now let's take a look at some of our 2019 plans. In 2019, we have a total of 29 Part D plans, 18 of which are enhanced and 11 are basic. We have 9 plans with a $0 deductible, and your lowest premium with a $0 deductible would be Silver Script Choice. That premium is at $30.80 this year, and we have 31% of our plan options as a $0 deductible. The number of plans that we have that are less than a $25 plan premium are 6, leading that at a 21% of our plans. Our lowest Part D plan premium is with Envision RX Plus. That's $14.50 this year. Our highest Part D plan premium is the Prescription Blue Option B, same as last year. However, the price has dropped $13.30 and is now $89.30. The average Part D premium for 2019 is $42.19, with 5 plans offering with coverage gap. And the lowest cost plan with the gap coverage is the Aetna Medicare RX Select at $17.10. Here's a look at the Part D LIS plans. We have Aetna Medicare RX Saver, Cigna HealthSpring RX Secure, Envision RX Plus, Express Scripts Medicare Value, Humana Preferred RX, Journey RX Standard, SilverScript Choice, Symphonics Value RX, and WellCare Classic. For our special needs plans, those that have chronic illness and are institutionalized, Erickson Advantage is the plan. It is available only for those residents of Fox Run. For our dual eligibles in Macomb and Oakland, the choices are Humana, Meridian, and Molina. In Washtenaw County, it would be United Healthcare Dual Complete or Meridian Care Extra. And in Livingston and Monroe County, it's Meridian Care Extra. Here's a look at some of the marketing guidelines for Part C and D plans. They cannot market themselves as Medicare endorsed. They cannot solicit from door to door. They cannot call people on a national and state do not call list. They cannot enroll people over the phone during a solicitation call. They cannot offer incentives or gifts that exceed $15 in value. They cannot market outside of the plan service area. They cannot engage in activities to mislead or confuse a beneficiary. And they cannot conduct sales presentations or collect enrollment applications at health fairs. If a beneficiary encounters this and mentions it to you, the counselor, make sure to let your site coordinator know and work together to let CMS know. Now let's get a review of Medigap Basics and general update info. Medigap Basics. We have our standardized plans A, B, C, D, F, G, K, L, M, N. The rating methods are community, issue age, and age attained rated. The enrollment periods for Medigap are during the open enrollment, which is the first 6 months a person has Medicare Part B and is age 65 or over. The guarantee issue period, which comes from an involuntary loss of coverage, or during that first 12 months when a beneficiary has the trial right due to an MA plan enrollment. Any other time will come with medical underwriting. It is important for you to note that not all Medigap plans will sell to anyone under 65 with a disability. If a beneficiary is under 65 with a disability and has Medigap and turns 65, they are then eligible for the Medigap open enrollment period. Here's a quick look at page 70 out of your Medicare and U books for 2019, showing the structures and the benefit options for the Medigap plans. You can also see that plans K and L have new out-of-pocket limits. For K, it's $5,240, and for Plan L, it's $2,620. Changes to Medigap. Effective 2020, insurers will no longer be able to sell Medigap C and F plans to any new enrollees in Medicare. Insurers can keep the current enrollees in C and F or sell to Medicare beneficiaries who were 65 before 2020. Why is this happening? Well, Congress wanted to level the playing field. There will be no plan any longer that will offer to pay the Part B deductible. There will, however, be an opportunity to purchase a high deductible G plan, replacing the high deductible F plan. Please note that it is very important to inform your beneficiary of these changes, as this will affect the cost the beneficiary will pay for that C&F plan in the future years. As the risk pool will decrease and no new folks join, the cost for the Medigap C&F will increase, changing that premium significantly over time for beneficiaries. In order to qualify for the Michigan Medigap subsidy, the beneficiary must be a Michigan resident and have a household income as a single person of $27,315 per year, or no more than $37,035 per year as a couple. There are 4 plans that accept the Medigap subsidy, and that would be AARP with United Healthcare, Blue Care Network, Blue Cross Blue Shield of Michigan, and Priority Health. Michigan Medigap subsidy reduces the monthly premium by $40 per month if the beneficiary is aged 65 to 75. Reduces it $65 per month if they're over the age of 75. And reduces it $125 a month if the beneficiary is disabled and under the age of 65. To help a beneficiary apply, call the 1-800 number listed on the slide or go to www.michiganmedigapsubsidy.com. Let's look at tools for how to shop for a Medigap plan. Things to consider are: is the beneficiary within their open enrollment or their guarantee issue? What's their health status, their age, type of Medigap plan they're looking for, the cost they're looking to spend, and the customer service. Your Medigap resources can be found at medicare.gov's Plan Finder, the Michigan Department of Insurance and Financial Services, the Michigan Association of Health Plans, and the Medigap Plan Finder available through ShipTools. A few counseling tidbits. Anytime that you select box 6 or 32 on your ShipTools client contact form, you'll need to have the Part D enrollment savings. For a beneficiary who's new to Medicare, your comparison should show a comparison for original Medicare costs in 2019 and the 2019 plan they're choosing to enroll in costs. The original Medicare costs will be the before, and the new enrolling plan will be the after. For a beneficiary who has already had a plan, the comparison will be between their current plan's 2019 costs and the new plan's 2019 costs, both of which can be found under the tab on Plan Finder, which says Estimate Total Costs of what the beneficiary will pay for their drug plan premium and drugs. When selecting Box 11, LIS Enrollment, or Box 43 for an MSP application or enrollment, the calculated savings amounts will automatically populate into the boxes. There's no need to enter any information there. Remember, you must make sure to report in ShipTools. Incorporate fraud education into your counseling. Always poke the bird. And if you haven't already, sign up to help at a Medicare open enrollment event in your county. Any questions for us to mull it over?